interesting because it tries to get to how the electronic death registration system within the US works and trying to improve that and make that better to improve public health surveillance activities across the nation. So currently, public health surveillance guides efforts to detect and monitor diseases and conditions, assess the impact of interventions, and assist in the management of and recovery from large-scale public health incidents. So electronic death mortality reporting plays a strong role within this, but currently only 36 of 57 different jurisdictions have an operating electronic death registration system, but not all those deaths are reported electronically. So there's a broad swath of reasons why that doesn't take place, but this entrepreneur is going to come in and help us to modernize the reporting system that comes in, help us develop these tools around data management and around analytics, which don't just help death reporting, but also help some of the other areas within public health surveillance and how our agency uses data from the public and with our public health partners. So primarily, this data is not usable in real time or near real time timeframes, but the tools of how this surveillance data is analyzed needs reliable estimates that need to be adequate. So if we increase the timeliness of this data, then more timely death reporting for their use within public health intervention will require the development of new tools or the modification or revamping of existing surveillance tools. So CDC recently developed a surveillance strategy which addresses ways for how surveillance can work across the agency and improve the overall surveillance capabilities, and by extension the public health system at large. And part of this is actually an initiative around electronic death reporting and making that data more available and more accessible. So we hope that this entrepreneur program will advance the cross-cutting initiative that we call mortality surveillance-related initiatives with the National Vital Statistics System, and really discover what it takes to improve the data management, data use, data accession, and then data analytics of our mortality data and then other related data sets. Our ultimate goal is that 80% of our death reports are transmitted into NCHS within 10 days of the day of the event for at least half the states, and then available to the state epidemiologists within 1 day of registration. So this replaces what's currently a very disparate set of timelines depending on the state and depending on the infrastructure within that state. And so it's really bringing the goal up to have that data available within a day of hitting the surveillance system, which then it's possible to use for novel surveillance methods, whereas it's not now because of the disparate variety of what timelines are in place depending on the states. And really it's mortality because this death information is critical for detecting and defining pandemics and other sort of huge events, as well as showing shifts in cause of death that breaks down age, race, ethnicity, gender, sex, and other factors which currently are difficult to do. So what we're looking for in an individual is actually a pretty interesting set of skills. So obviously, close collaboration and being able to work with diverse groups in different geographic regions. So CDC, we are primarily in Atlanta. I sit in Atlanta, but the National Center for Health Statistics is up in Hyattsville, Maryland. And so being able to have those relationship building skills, not just traditionally, but across geographic regions is really important, and being able to coordinate a lot of different groups together towards this goal. Also, what we call sort of cross-lateral thinking and developing different system models for how these different databases and data sets can be enhanced, and also the different analytic tools that can be applied to it. It's really helpful to have experience with healthcare or have experience within public health, but it's not required. So it'd be great if you do, but if not, we have a lot of really smart experts in public health and really great subject matter expertise that will pair with you to bridge that gap. There's also, because of the flexibility and a lot of the dynamic elements, experience with sort of open source or agile development, software architecture and design approaches is really useful because it goes into the iterative nature of how we incrementally build on pieces and plug them together. Of course, analytics, big data, data use and data analytics is extremely important, and it's integral to the entire project, but also an element of user-centered design and how the reason we're actually going through this modernization effort is to improve the use of the data and the usability of the data within our surveillance programs. What's really cool about the entrepreneur coming in is they're able to enhance that and also address what's not just a death reporting problem, but really a public health surveillance data problem. And so what the entrepreneur brings in new is a skill set to take what's effectively a data analytics challenge, apply that to this one very specific problem area, which is death reporting, but then also have reach to other elements of public health and other elements of data use. And I think that's the novel part of what the entrepreneur brings, is this ability to be sort of the force multiplier, the extension of what's already an important project, but have that project go further than it would have been without having somebody with this unique skill set.